Dear colleagues, periodontal disease is one of the most important chronic diseases in the world. Today we are in the dental practice of Professor Gonzales and Dr. Engelscher, and we are going to speak about new classification of periodontal disease which we have since 2018. Also, we're gonna speak about some systemic conditions and diseases and association with periodontitis. Let's meet Professor Gonzales.
Professor Gonzales, nice to see you.
Dear Professor Gonzales, since 2018 there is a new classification of periodontal disease, and I want to ask you, in your opinion, what is the importance of new classifications for our patients and also the dentists?
Yes. Throughout the years, they have always been different classification developments in periodontal diseases and conditions, and this is always important because it is necessary to actualize all the knowledge that there has been developed in the last 20 years and to integrate it in a new form of classification of the diseases and conditions. And for example, one of the most important aspects now in this new classification is the way that we have now to diagnose and to look at the healthy situation, at the healthy tissues, at the healthy situation in cases of gingivitis and also of periodontitis, of gum diseases, because in the past this was not so clear. And today it's possible to say to the patients, you know, we have had a very long time period of treatment and we have reached a good result, and this is a stable situation in the mouth without bleeding and without periodontal destructions and pockets. So it is possible with some type of parameters to give the diagnosis of periodontal healthy situation, healthy tissues. And yes, this is also important for the clinician and for the patient. And the other important aspect is that in the past we had some names which classified and described the disease in a way that it is not more up to date and it is not more accurate anymore, because you know, chronicity, aggressivity, it's okay, it has worked, but it is today we have much more knowledge on the inflammatory process and on the genetic backgrounds and also on the different risk factors and systemic conditions of the patient. So it is much more accurate, and also I would say it is more modern today due to this all knowledge that we have achieved in the last 20 years to classify in stages and grades, because you know, you can have a very a disease that it is severe and that this is affecting a lot of teeth in the mouth, and then you can say, okay, we have a stage 4, which a lot of bleeding and a lot of periodontal destruction, and also a severe case. So you can say we have a grade C, you know, and in the center we have stage 3 and stage 2, that it is not so big destruction and less bleeding and so on, and this is a moderate situation, so we have a grade B. But we can also have some lower cases with with a lower progression and also with a more lower destruction, and then we have a situation that you can stage in 1 and you can grade in A. But that is all very fluid, you know, because it is changing. Yes, it is changing in the patients. So that is important for the patients, that is important for the students, and that is also important for the clinicians.
If we speak about pathogenesis of the periodontal disease, what is new in our understanding about the development of periodontal disease?
Yes, you know, this has changed completely, and I mean modulated by the genetic background. It is modulated by environmental factors, so that it is so multifactorial. And this approach, this knowledge about all these topics, and also the new knowledge on behalf of how the oral biofilm is interacting with the cells, with our immunological cells, has completely changed in the last 20 years. It has been a huge development on this, and therefore this was necessary, because the pathogenesis is today much more based on these changes. We have a disbalance in the oral cavity, in the situation in the gums. We have a disbalance between the etiological situation, the factors, the bacteria which becomes destructive, you know, and it is all producing mechanisms, it's developing mechanisms that produce these inflammatory processes, and all this cascade what is happening, it's then developing in the clinical signs of the periodontitis, you know. So therefore, that was completely necessary to assess all this new knowledge.
So the immune inflammatory answer of the body to the presence of bacteria in the mouth is the main contributor to the development of the disease. And what about the patients, your patients in your dental practice? If they ask you, dear professor, why do I have periodontitis? Why do others don't have it and I have it? What about susceptibility of individuals, and why do some people have these periodontal problems and others not?
When the people comes and they ask why is this happening to me, why I have this disease, then I always answer, it is difficult to see it by your own at home, for example, because it does not cause pain, and sometimes you don't have any signs of the problem. And so in the clinic you take the measurements and you look at the bleeding and you look at the x-rays, and then you see the disease. So you can explain this to the patient, and you can say to the patient, the problem is, of course, that they are not feeling pain, so the disease is already there and it is progressing, but the oral hygiene at home, it's not enough anymore to stop the disease. So it is necessary to perform a treatment. And yes, and then in the case of some susceptibility, of course, you know, you have to tell to the patient that there are some type of situations where genetics is also a part of the problem, you know, the heritage, because there are some younger people with severe cases and so on, and of course also our environmental factors, the nutrition, the also habits like smoking, but also some very important systemic diseases that are contributing to the problem.
And what is the connection between the systemic diseases and all these conditions and periodontal disease? So we know that the patients, for example, with diabetes are more susceptible to the disease and to the disease progression. So do your patients in your practice with other systemic conditions, other systemic diseases are more susceptible to periodontitis?
Yes, this is a very important question. And about systemic diseases and periodontitis, we know a lot today. And for example, diabetes and atherosclerosis and also cardiovascular diseases. We have here a very nice view. Look, this is the main place. Okay. Yes, you know, in this case, that many patients have this different systemic diseases, and there is a known association between the oral inflammation in the case of, for example, periodontitis and, for example, metabolic syndromes and diabetes, in this case diabetes mellitus, because the factors, the inflammatory factors that are being constantly produced in the oral cavity, in the gums, because of the inflammation, they are producing some systemic problems, like they are contributing to a bad glycemic control of the patient, and also contributing to a peripheral to a systemic inflammation. And in the case of specifically of diabetes, there are also some problems that are being produced by the tissues and by the cells, and these are some glycemic acetylated factors that are also going through the blood into the body, into the systemic body, and are disturbing the glycemic control. So the way around, if you have diabetes, then you have also a bad control of your metabolism, and then in most of the cases it is also associated with some adipositas, with some fatty cells that are also producing inflammation, first systemically and then also in the oral cavity. So it is an association from both sides, you know, and more or less similar problems are with the patients that have some cardiovascular diseases, because, you know, the inflammation in the oral cavity, in the gums, in the periodontal tissues, with the production of these inflammatory factors, this increase the inflammation also peripherically in the systemic situation in the body, and then you have also production of this inflammation in the atherosclerotic plaque, for example, in the arteria and also in the coronary vascular arteria in the heart. So that is also a problem for the patient.
What advice can you give to the patients who have also some systemic diseases or other conditions? Is it necessary for them to make a periodontal screening, a periodontal checkup?
Yes, of course. If you have some systemic diseases, if you know that you have this, then it is totally important that you have a periodontal check immediately, or if you already have some type of treatment, that you have a supportive treatment. You have to go to your check every in a regular basis, every 4, every 6 months, that depends. And this is important, and also for the clinician it's also interesting that nowadays you are allowed, you can just simply take a small blood sample, a chair side, and you can just simply test the glucose, the glucose levels, and just check if there is a problem with a metabolic disorder. And yes, this is my advice also for the patients.
Thank you very much.